How tall a human being will be as an adult depends on many factors, but first and foremost is genetics. Tall parents tend to have tall children, and short parents tend to have short children. Several hormones also affect growth and development, either directly or indirectly. The two most important are growth hormone and thyroid hormone. Growth hormone stimulates protein synthesis in bone and muscle. It also stimulates the use of fat as a fuel, so that lean body mass increases. Growth hormone, also called somatotrophin, is secreted by the anterior pituitary gland under the control of two hormones from the hypothalamus. One of these is growth hormone releasing hormone, or GHRH. When growth hormone levels are high enough, feedback to the hypothalamus inhibits the release of GHRH and stimulates instead the release of somatostatin. Somatostatin slows the release of growth hormone in the pituitary. Like growth hormone, the release of thyroid hormone is controlled by the hypothalamus and pituitary. Besides being necessary for normal growth and development, thyroid hormone also stimulates the metabolism of nearly every tissue in the body.
Growth hormone and thyroid hormone are synergists, meaning that they increase each other's effectiveness to promote natural growth and development. Neither hormone alone can cause normal growth. For example, if there isn't enough thyroid hormone present during gestation in the womb or during infancy, the baby will have a form of growth and mental retardation called cretinism, even if growth hormone levels are normal.
Growth is also affected by the sex hormones, testosterone and estrogen, both of which accelerate growth, especially during puberty.
Because testosterone causes protein synthesis, especially in muscles, some athletes may take various forms of testosterone called anabolic steroids to enhance muscle development and performance. There are both physical and psychological risks to using anabolic steroids, including an increased risk of heart attack, stroke, sterility, and some cancers. Many areas of the brain have receptors for testosterone, so steroid use can also lead to aggressive behavior, depression, and delusions.
Hormones are involved in every aspect of reproduction. During development, hormones determine the physical sexual characteristics and produce and maintain the physical traits that are associated with being male and female. Estrogens produce female characteristics, and testosterone produces male characteristics. Hormones also control the production of eggs and sperm, and pregnancy, birth, milk production, and nursing. When a person is exposed to danger, the immediate response of the central nervous system is to signal the medulla in the adrenal gland to release epinephrine and norepinephrine. These hormones are also known as adrenaline and noradrenaline.
Within milliseconds of the stimulus reaching the brain, nerves send these chemicals to the blood vessels and to virtually all of the internal organs. The person is suddenly alert. The heart and breathing rates increase. Blood glucose levels rise, and blood flow to muscles increases. This is often referred to as the fight or flight response.
The medulla can secrete those hormones for a few days if necessary. If stress continues beyond that, the brain signals the hypothalamus, which signals the anterior pituitary to release ACTH, adrenocorticotropic hormone.
ACTH travels through the blood to the adrenal cortex and stimulates the release of glucocorticoids, primarily the hormone cortisol. Cortisol raises blood glucose levels and increases blood volume and blood pressure. It also suppresses the immune system and the inflammatory response that could cause swelling and pain.
For example, if a person falls and sprains an ankle while hiking in the woods, epinephrine from the adrenal medulla helps prepare the person for the exertion needed to get help. Cortisol from the adrenal cortex keeps the ankle from swelling and allows the person to keep walking on it.
Suppressing the immune system can be a life-saving response, but there are risks involved. If it continues for any length of time, it can make the body more susceptible to disease-causing organisms.
Certain minerals are critical to the proper functioning of our body systems. Through the release of various hormones, the endocrine system ensures that the body maintains the required levels of those minerals. One of the most important is calcium. We all know that calcium is essential for such things as strong bones and teeth. But did you also know that without calcium, your blood will not clot adequately, nerves and muscle cells cannot function, and many hormones and enzymes will not work? To ensure the proper functioning of all these systems, the body regulates the level of calcium within very narrow limits. 3 hormones are primarily responsible for this regulation: parathyroid hormone from the parathyroid glands, calcitonin from the thyroid, and active vitamin D from the liver and kidneys.
The cells of the parathyroid gland have calcium ion receptors on them. As blood calcium levels decrease, the cells respond by secreting parathyroid hormone. This causes the kidneys to increase the amount of active vitamin D.
In response, bone cells begin to release calcium from bone tissue within minutes.
If the calcium removed from the bones is not replaced by calcium in the diet, the bones will weaken. This is often what happens to older people, accounting for the stooped shoulders and the frequent fractures among this group. For this reason, dietary recommendations for calcium are fairly high, from 400 to 1500 milligrams per day, depending on age. As people get older, they need higher levels of calcium to prevent bone loss.
Parathyroid hormone also acts on the kidney to increase the reabsorption of calcium from the fluid in the kidney tubules. This puts calcium back into the blood instead of being excreted in the urine. As blood calcium levels increase, less parathyroid hormone is released, and the thyroid gland begins to secrete calcitonin. The primary action of calcitonin is to inhibit calcium-releasing activity in bone cells. As a result, blood calcium levels decrease. The body is 60 to 65% water. Dissolved in the body's water are a number of chemical substances called electrolytes.
Electrolytes are charged particles called ions. These ions are necessary for nerve impulses and muscle contraction, so their concentrations in the blood are carefully regulated.
Water and electrolyte balance needs to be maintained. The most important electrolytes are sodium, potassium, magnesium, and chloride. The electrolyte that requires the closest regulation is sodium. Several hormones work together to maintain normal water and electrolyte concentrations. When the brain detects an increase in sodium concentration in the blood, the posterior pituitary releases antidiuretic hormone, also called vasopressin, which acts on the kidney to reduce urine output. Less water is excreted, so more returns to the bloodstream. When blood pressure decreases, the filtering units in the kidney release renin. Renin converts a protein made by the liver called angiotensin I into angiotensin II, which stimulates the release of aldosterone from the adrenal cortex. Aldosterone causes the kidney to preserve fluids, thereby raising blood pressure. When blood pressure increases, the right atrium of the heart releases hormones called atrial natriuretic factors. These factors stimulate the kidneys to produce more urine, which reduces fluid volume in the blood, which reduces blood pressure. During exercise, the body can lose large amounts of water and electrolytes in the form of sweat. There are many sports drinks on the market that contain water, sugar, and salts. Besides replenishing fluids, the sugar in these drinks provides energy, and the salts replace electrolytes that have been lost. A sports drink may also help your performance and increase your endurance because you'll be better hydrated. The endocrine system is essential to the proper functioning of the human body. The hormones it produces are an indispensable part of our body's complex system of control and communication. Produced by many different organs and carried by the bloodstream to cells throughout the body, hormones affect growth, help us deal with physical and psychological stress, and keep virtually all of our body systems in balance.